Gastric bypass surgery. What you need to know: all around the world, there are millions and millions of people who are overweight. For many of these people, their struggle with weight has been lifelong. We live in a world where we see all kinds of advertisements showing slim people enjoying life, and many of us strive to look like the people in the advertisements. Unfortunately, things don't usually work out the way we want, and when we do lose weight, it is usually not nearly enough. When weight is lost slowly, which is the healthy way to lose weight, people become frustrated and often go off their diets, eating more and gaining even more weight than they had to begin with. When weight becomes a really serious issue, traditional diets and exercise may not be enough, and there is a need for medical intervention, from specialized diets to surgery. There are many cases of obesity that are successfully treated with gastric bypass surgery, which helps patients to lose weight by changing the size of their stomachs to not allow as much food to go in. What is gastric bypass surgery? Basically, gastric bypass surgery is a procedure that will help someone who is obese to eat a lot less. A small stomach pouch is created surgically, which makes it so that the patient is unable to eat as much as they did previously, and it makes it so that the body is not able to absorb the food as easily as it once did. In fact, once a person has gastric bypass surgery, they're usually only able to eat about 1 or 2 ounces of food in a sitting, which is going to help them lose weight. These are extremely risky surgical procedures and are usually only performed on patients who are morbidly obese, having more than 100 pounds of extra weight and a BMI, body mass index, of 40 or above. Common types of gastric bypass surgery. There are many different gastric bypass surgical procedures, but the most common types are Roux-en-Y gastric bypass surgery and extensive gastric bypass, both of which are designed to help those who are so obese that traditional diets are not working. But it is also important to remember that these types of surgical procedures are not cure-alls, and that they must go hand in hand with a healthy diet and exercise of some sort. The most common type of gastric bypass surgery performed in the United States is Roux-en-Y gastric bypass surgery. Part of the stomach is stapled so that there is only a small pouch left, limiting the amount of food that the patient is able to eat. Another aspect of this type of surgery is a Y-shaped section of the small intestine is attached to the newly created pouch. This allows the food to be digested without going through the duodenum and the first part of the jejunum, so there are not as many calories and nutrients absorbed by the body, making it easier to lose weight. There are newer ways to perform this type of gastric bypass surgery, with a laparoscope, so that there are only small incisions and the recuperation time is minimal. Extensive gastric bypass surgery, also referred to as biliopancreatic diversion, is a much more intense surgical procedure and the lower part of the stomach is removed entirely. What is left is then connected to the last part of the small intestine, so the duodenum and jejunum are bypassed totally, so that even fewer calories and nutrients are absorbed. This is a much more dangerous procedure than the Roux-en-Y gastric bypass surgery, and it is not performed nearly as often due to the dangers involved, and the fact that patients may actually not get enough good nutrition following the surgery, because the body will not digest and absorb it. The risks of gastric bypass surgery. As with any surgical procedure, there are risks that go along with gastric bypass surgery, including stretching of the newly created pouch, erosion of the band, used in lap band surgery, and even the leaking of stomach contents into the abdomen. Some of the symptoms that people may have following any type of gastric bypass surgery include weakness, vomiting, dizziness, excessive sweating, and diarrhea after eating. If weight loss is rapid, gallstones may even develop. It is very important for gastric bypass surgery patients to make sure that they are getting enough fluids following surgery, as they can be more prone to dehydration. Gastric bypass surgery patients require a special diet, because gastric bypass surgery makes it so that the body does not absorb nutrients as well. It is even more important than ever that patients follow a healthy diet. These diets will often be highly restricted in order for the patients to be able to lose weight, but will contain foods that are extremely healthy and loaded with the nutrients necessary for good health. Protein is essential, not only for energy and good overall health, but it is also good for the soft tissues and will help in the healing process following any surgical procedure, including gastric bypass surgery. In the case of people who are too overweight to have gastric bypass surgery, they are often hospitalized and placed on a restricted diet before being able to undergo surgery. Often, because these diets are so restricted and because the body is not able to absorb nutrients, physicians will recommend that their gastric bypass patients use protein supplements to make sure that their bodies are getting what they need. When using supplements, it is important to keep in mind that many are used for weight gain, and you must carefully read the ingredients and nutritional information to make sure that you get one that is low in fat and calories. Protica has some products that are excellent for use after gastric bypass surgery. Liquid protein shots are low-calorie protein supplements that are often used by those who are on extremely restricted diets. ProfectR is an excellent choice, because not only does it provide 25 grams of protein in each 2.9 fluid ounce serving, it also provides 100% of the daily recommended amount of vitamin C, and 50% of the B-complex vitamins. Profect only has 100 calories per serving and contains no fat, carbohydrates, or cholesterol. And it comes in all kinds of delicious flavors. If you are in a restricted diet and want a taste of something sweet, Profect is the way to go. For more information about Profect and other protein supplements available from Protica, you can visit the website at www.protica.com.